As stated on Shriners' website, 1.4 million children have been treated by Shriners Hospital for Crippled Children, regardless of their family's ability to pay. I personally have been treated by Shriners. When I was 13, I had back surgery there, and my parents didn't have to pay anything. They also gave them a place to stay while I was hospitalized there for 20 days. If you donate to Shriners Hospital for Children, you are helping children with neuromusculoskeletal conditions, burn injuries, and other special health care needs to get the care and treatment they need regardless of their family's ability to pay. Childhood health conditions like these have always affected children, but a place to get treatment without pay has been much needed. Many children and their families are affected by these special health care needs. Children from all over the world have been treated by Shriners hospitals. First, we'll look at the need children have for the specialized care Shriners Hospital offers. Children are born daily with the need for specialized health care treatment. There is also a need for burn setters that specialize in treating children. According to the National Center for Injury Prevention and Control, between 2001 and 2011, more than 1.5 million children sustained burn injuries. Shriners Hospital has 5 burn centers in the United States. In a study done by Tina Palmieri, MD, Assistant Chief of Burn at Shriners Hospital, wrote the Pediatric Critical Care Medical Journal for children in North California shows a high volume of burn centers have the lowest mortality rate. This could reflect the greater experience, resources, and specialized expertise in treating pediatric patients. The study proves the need and importance of pediatric burn centers like Shriners Hospital has. There are also 16 hospitals over the U.S. that treat orthopedic disorders, spinal cord injuries, and cleft lip and palate. Scoliosis is an orthopedic condition commonly treated at Shriners Hospital for Children. Scoliosis is a complex spinal deformity involving lateral curvature of the spine and spinal rotation causing rib asymmetry. And this picture here shows the before picture with the curve, it looks like an S, and then it shows after treated at Shriners how it straightened the spine with the rod. Shriners Hospital offers several different treatment options for scoliosis, including maggot, which does require a surgical procedure to implant the rods, but as the child grows, they can lengthen the rods using an external remote in an outpatient setting. Thankfully, the Shriners built these hospitals especially to treat children. Shriners hospitals were built to help children with orthopedic disorders. As wrote on the Jaffa Shriners webpage, Shriners International, commonly known as the Shriners, describes itself as a fraternity based on fun, love, and the Masonic principles of brotherly love, relief, and truth. Shriners have been known since their earlier days for their philanthropic efforts, such as after 1906 San Francisco earthquake, Shriners spent $25,000 to help the city rebuild. In 1919, one of the Shriners, named Freeland Kendrick, visited the Scottish Rite Hospital for Crippled Children in Atlanta, where he became aware of the overwhelming need to care for children with orthopedic disorders. Kendrick then traveled more than 150,000 miles, visiting most of the 146 shrine temples and campaigning for money to start building a hospital for crippled children. In 1922, the first patient was admitted to their first Shriners Hospital for Crippled Children in Shreveport, Louisiana. A girl with club foot who learned to walk on the top rather than the sole. Shriners Hospital for Children are experts when it comes to pediatric orthopedic care, and virtually every pediatric orthopedic specialist in the United States has done a rotation during their education at Shriners Hospital for Children. Shriners Hospitals for Children are world-renowned for the research that has led to discoveries that have affected medical care for all ages. Thanks to the Shriners for opening these hospitals, children from all over get the care they need. Katie is one of the many children who were able to get treatment so she could walk around like other children her age. Katie was a 2.5-year-old little girl living in an orphanage in China, where at 2 months old, she was accidentally placed in an untested bathwater, seriously burning her left leg and side, where scars left her foot contracted. And this here's a picture of Katie. Right after that happened, you can see the burn and how her foot is stuck upwards like that. A Pittsburgh, Pennsylvania police officer went to the orphanage with the intent to adopt a baby, but met Katie and fell in love. She took Katie to a hospital in Pennsylvania where the doctors wanted to amputate her toes. So she wanted a second opinion and went to Shriners Hospital in Cincinnati, where the doctor told her, "Please do not let anybody cut off that baby's toes." Now Katie is 6 after several surgeries, which is not uncommon in pediatric burn cases. Katie still has her toes and can run and play like the other children her age, thanks to Shriners Hospital. And this is an after picture of Katie, and you can see she's able to sit Indian style and her foot's now straight and not contracted. So I urge you to be a part of helping these children by making a donation to Shriners Hospital for Children. Even if it is a small amount, every penny counts. As long as Shriners Hospital for Children receive donations, they will be able to continue helping children all over. Thank you.